this real quick. So the frontal lobes are the front part of your brain. That's where they sit, and they have lots of different functions. And the most important thing is when the frontal lobes stop working as well as they should be, that's when we start to see a lot of symptoms, symptoms in behavior, lack of inhibition. So you can see here on the left side, it's really responsible for your personality, how you respond emotionally to certain situations, and also how you engage socially with others. And when the frontal lobe isn't working well, you lose inhibition. So basically, you're not able to hit the brakes. I've talked about this before, but being able to hit the brakes efficiently means that the brain's working really good. And if you can't hit the brakes in terms of impulses, thoughts, or behaviors, then we know that the frontal lobe may not be working as well as it should. A lack of initiative. So, like difficulty getting started on a task or a job, or difficulty completing certain tasks, or just really not caring at all. Antisocial behavior. So, staying away from people that you typically would like to hang out with. You're kind of just in your own little cubby. But, that's different than being an introvert. Sometimes like being out with people can be a little driving like the anxious pathways or anxiety. So it's not the same as someone that doesn't really prefer to be around people, but if someone who usually is typically socially engaging and likes to be around people and then they're not, if there's some sort of shift in their personality, that's when you start to ask like, hey, what's going on with that person's frontal lobe? Maybe it's not as well as it could be. Impaired memory. So as you know, the temporal lobes also play an important role in memory, but the frontal lobes kind of have their hands in everything, right? You can think of your frontal lobe as the CEO. So lack of good frontal integrity can lead to memory issues. And you see that in neurodegenerative diseases like Alzheimer's and Parkinson's and in dementia as well. So incontinence, this one's an interesting one. So the frontal lobes, they're the last part of the brain to really kind of mature and develop. So regarding incontinence, you can see like when kids really start to build good muscles in their frontal lobe, they start to become more continent. If there's some sort of dysregulation in the frontal lobes, they may have a more difficult time becoming continent. So there's frontal lobe exercises that kids could do to try to build those pathways and try to shut down some primitive reflex responses to reduce their incontinence episodes. And same thing on the other end, when we start to lose the function of the brain, we start to lose the brain to bladder communication, and you can become incontinent in your older years, which is why, like adult diapers are such a thing, because it's a necessary thing, but it's a real question to ask about, hey, how well is that frontal lobe working? Changes in grasp reflexes and anosmia, so changes in smell too, or difficulty smelling. Frontal lobe function. So lots of different functions, just to touch on a couple: judgment, movement, attention, motivation, planning, and then I can't see this one, reward. So the frontal lobe is what makes us human. And it really helps with driving our motivation, being able to properly socially engage, be happy, things of that nature. So the frontal lobe is really important, and we need to focus a little bit more on it regarding health. Usually, with healthcare, you see a lot of neck down care, but we really need to focus on brain health and the aging brain as well when we're doing our health assessments. Okay, so frontal lobe lesions, difficulty with sequencing tasks. So like trying to make a cup of coffee may become very difficult for the person. Changes in behavior, personality. So like we said earlier, if you've ever heard of Phineas Gage, he was the gentleman who had a like railroad construction pipe or something go through the front part of his brain. And he lived through it, but they were able to see these crazy behavior changes. He used to be a really nice dude, and then he turned out to be a total jerk after his frontal lobe got damaged. And that's what kind of started the whole process of understanding frontal lobe lesions. That's a traumatic physical lesion, but these can also happen with time, with environmental exposures and things of that nature. So loss of spontaneity and interacting with others, loss of flexibility of thinking. So I call that cortical flexibility, right? You're just very rigid in your thought process. You can't really understand or see other people's beliefs or opinions. They're kind of, you just think that what they think is stupid or what you're hearing is stupid and your way is the only way. Changes in expressive language. So this is more speaking of like the motor aspect of being able to produce speech, because the majority of our speech centers sit in the left hemisphere, and Broca's is in the left frontal cortex. Persistence of a single thought, so perseveration. I have a 2.5-year-old, and I have no idea how he does this. His memory is so crazy. Like, he'll remember this one specific little toy. Like last night before he went to bed, it was this green Jeep that he has, a little Hot Wheels truck. He played with it like 3 days ago, and then he had to have it before he went to bed, and he freaked out until we found it. So my wife and I are like on our hands and knees digging through all of our toys. So it's like, just please go to bed. Because I would present him other toys, and he's like, no, I need this toy or else I will not be able to fall asleep. And I'm like, gosh, dude, when's your frontal lobe kicking in? But perseveration of thought or action. So with perseveration, that's basically you're not able to hit the brakes, right? You can't turn off that road of your thought process. So a good frontal lobe can do that. What a patient may complain of, they may have mental fatigue, right? So doing mental tasks makes them tired. So for some people read books so they can fall asleep and take a nap, but maybe it's the whole engaging in the reading process, the cognitive aspect of reading, using your eyes to move across the page, thinking about what you're reading, that can mentally fatigue you. Or when you're in a new job, if you're trying to learn something new, it takes a lot of cortical fortitude to really get in there and learn what you're supposed to learn. So it could be tired and exhausting for patients and people. Impulsiveness, right? They can't hit the brakes. They're just impulsive with their behaviors, impulsive with their thoughts. They're not really thinking things through. Difficulty making decisions. So where do you want to eat for dinner? I don't know. Where do you want to eat for dinner? I don't know. Where do you just pick a place, right? So actually the practice of making decisions is really good for your frontal lobe. Even if you could care less, if you're presented with, hey, what do you want for lunch? If you just say, this is exactly what I want, instead of going back and forth, it's actually a good little exercise for your frontal lobe. So try making decisions throughout the day, as long as they're good ones. Don't make any bad ones. Lack of motivation, interest, and enthusiasm. So, you see this as we age, right? Like, we kind of build a tolerance to what life has to offer us. We get beat down by other people, like missed opportunities and stuff like that. So we just lose our motivation, we lose our interest, we lose our enthusiasm. So trying to get that back and working on that is really important for the front part of our brain. Decrease in attention span, right? Squirrel, looking all over the place, not really being able to stay focused and be attentive in the present moment. Difficulty appreciating art or music. I mean, I have difficulty appreciating some art, so I don't know about that. Anyways, just not caring, right? Having that general like not caring attitude. Episodes of depression, which I think it's safe to say a lot of people have felt depressive waves throughout their life, and depression is a serious issue. But when you look at the effects of frontal lobe health and depression, it's important to really, really consider what that person could be doing to try to make their frontal lobe work better so they don't suffer from bad depressive episodes. Emotional instability, so they're kind of up and down all around. You don't know who you're going to get on what day. I'm sure we've all had a colleague like that or something of that nature where you walk in and you're like, oh man, I hope he's going to be cool today. And then when they are cool, you're like, who is this person? When are they going to flip on me? Like, this is crazy. So I've worked with a couple people like that, and it makes it difficult. It makes the workplace difficult. If your partner's like that, it makes life difficult. So it could be an issue with the frontal lobe. Difficulty with linear thoughts. So being able to go from point A to A to Z without taking too many side roads with your thought process. Reduced muscle endurance. So as we know, the front part of the brain, like the premotor cortex area, is responsible for engaging our muscle activity, and constant feedback and efficiency is important for muscle endurance. Difficulty initiating movements. So you'll start to see that in neurodegenerative issues, like in Parkinson's disease, for example. Sometimes a patient may get stuck when they're walking because something may be in their line of walking, and they can't get past it. They have to kind of like get stuck and they can't get moving again. So the motor programs start to get messed up a little bit. Increase in muscle tightness. So that that can lead to what's called like muscle rigidity and stiffness. And there's just issues with communication between the muscles and the brain, that back and forth loop. Feelings of arm or leg heaviness and difficulty with speech. So we kind of mentioned the difficulty with speech before. Okay, so some general ways to really just give your frontal lobe stimulation is to move, right? One of the best things you can do in the morning when you wake up is just get moving, because it really helps kind of wake up your brain from those sleep states that you're in. And movement is really good for global brain health, but with a little bit more of a focus on the frontal lobes. Another way to stimulate the brain is by learning a new sport or activity, learning a new game or skill. So like a new board game, something that's challenging, a new video games. You know, not all video games are bad. They can be really, really good for your brain. And then working on your reaction time. These are just to name a few. It's not an all-inclusive list. So let's just talk about a couple different areas of the brain. As I mentioned earlier, a couple areas of the frontal lobe, the precentral gyrus. So this really has to do with creating those motor pathways that go from brain to brainstem to spinal cord to creating movement. And this was just a picture of, I just wanted to show you a side picture of where the precentral gyrus is located. It's right in front of the postcentral gyrus. And then it's basically called your motor strip. You've got all these fibers that run from different areas of the frontal cortex down through the subcortical areas into the brainstem and then out to the motor areas. So if there's an issue with the precentral gyrus, you may see motor issues. But again, it's not to say that there can't be anything messed up in between, right? It all depends on the level of where there's an issue within the neurology of the patient. But just to kind of speak about movement, I found this paper. I thought it was pretty cool. And what this paper talks about is how exercise can improve cognitive performance and brain plasticity. I know this is kind of like beating a dead horse, because I've posted a lot about how exercise is so important for brain health, but I don't think, like, you know, something that's super duper cheap and easy to do. So all you need is like a pair of running shoes or doing push-ups or body weight squats. You don't need a beautiful fancy gym to get your brain in shape. But also this paper is pretty cool because it talked about high intensity interval training and its effects on opioid receptors in the brain. And as we know, you know, like a lot of research will say you're kind of getting some sort of opioid response when you do some sort of high endurance or high intensity exercise. So what this paper showed was that there was decreased opioid receptor site availability after exercise, which went on to conclude that by doing high intensity interval training, you're actually releasing more endogenous opioids. Those receptor sites are accepting those endogenous opioids and you're getting this opioid response. And it's really, really good for key areas of the brain that are related to reward processing, but then also pain processing. I've said this before, but a good brain can modulate pain. So the better and more efficient our brain is working, the less pain we should have, because pain is a perceived stimulation within the brain. That's all I really want to say about that paper. I just thought it was pretty cool. Let's go to the next one. Oh, I'm sorry. That's not all I wanted to say. So this just showed, you can see in the image to the right, it reflects regions showing significantly decreased receptor site activity or availability for the opioids in comparison to just rest patients. So this is a cool paper. If you can type this in, you can pause it and type that into the Googles, and you'll be able to find that paper if you're interested. Another area of the brain called the medial frontal gyrus. So this is kind of the inside, if you slice the hemispheres down the middle through the corpus callosum. The medial frontal gyrus, it's right here. And it's a pretty cool little area. It's an extension of the superior frontal gyrus, and it's been shown to play a role in executive functions and tasks such as go-no-go exercises. So when I think of go-no-go exercises, I think of a kid's game like red light, green light. And what I mean by go-no-go is you're in some sort of reaction mode where you have to get ready to go, but then also you have to get ready to stop on a dime. So with red light, green light, obviously if the person playing calls out green light, you start running, and as soon as they say red light, you stop. And if they yell out red light again, you're wanting to go and run, but you're not allowed to go. You have to stay and wait. So red light, green light is a great game. It's really, really an awesome game for kids to play, to be able to try to mature those frontal lobes in a healthy way, because you're getting really good physical activity. The body is moving, but then they're also trying to cortically interpret how to play the game and play it appropriately. So this is a really cool game. And again, it's an area of the front part of the brain that's responsible for inhibition, um, the medial frontal gyrus. Another thing we could do for the medial frontal gyrus are different types of, I call these reaction sticker games. There's really great software out there for practitioners to use. There's something called the NSI, the Neurosensory Integrator. There's also a technology by a company called Binovi in Canada that makes these boards electronically, so you can really objectify the data. But if you're at home and you're still doing quarantine because of coronavirus, a great game for kids is to get these little stickers that you can buy on Amazon. I think the company's like Avery or something, but they're just different colored stickers, or you could just draw them on a piece of paper, and you have your child or a family friend stand in front of them and you call out the different colors. But then you can make up rules along the way and say, hey, you can only touch green with your left hand and red with your right hand. You can make them do finger to nose. So every time they touch a dot, they have to come back to their nose. You can make them stand on like an uneven surface, like a soft pillow. They can stand on one leg. You can get all sorts of crazy with this, but it's a really good frontal lobe exercise game. And you can make tons of rules up for it to make it a little bit more challenging. I posted this one before in one of our slides, but this is the reaction card game. I like this one because it's really quick, right? You have to try to inhibit an unwanted reaction, which is a great frontal lobe exercise. So you just grab a deck of cards, shuffle them, tell the patient to raise their right hand when they see a black card and their left hand when they see a red card. You can make this more difficult by switching it up. So you could say, hey, I want you to raise your right hand when you see a black card, but if it's a king, queen, jack, or ace, you don't raise any hand at all. So things like that, just to make it a little bit more difficult. And if they do the wrong hand or something of that nature, then they're out and they have to like wait their turn to go again. Because waiting is a difficult thing for people with immature frontal lobes to do as well, because they're impulsive and they want to get back into it. So sitting and waiting is really good. While they sit, they can meditate, because that activates the frontal lobe too, as we'll see in a second. Another area of the brain, so this is kind of like looking down under. So if you're kind of like looking up my nose at the frontal lobe, this is the orbital gyrus. So you can see here in this olfactory sulcus here, this is where the olfactory nerve and the olfactory bulb sits. So it's a nice little crevice for that extension, that nerve to sit there. But the orbital gyrus has actually been shown to be activated during stimulation to one of the portions of the vagus nerve. So vagal nerve activation can actually stimulate the front part of your brain, which I thought was pretty cool reading that, because I'm always thinking if we're just doing vagus, we're really just kind of directing towards the brainstem and the lower brainstem areas, but you're getting activation of the brain as well, which does make sense through vagal nerve activation. So vagus nerve activation is one of the best things, I think you can do for your brain and body, because a lot of us are just stuck in sympathetic fight or flight reaction mode, and trying to shift towards a little bit more of a parasympathetic rest and digest is healing, it's calming, and that's where you can really build a sticky plasticity in the system. So aromatherapy with deep belly breathing, we've talked about this before, but doing deep diaphragmatic belly breaths will stimulate the vagus nerve through different canalized or hardwired pathways of those vagal nerve fibers. And then, obviously doing that as well oxygenates the system. It's a great brainstem exercise. Using different smells to activate different areas of the brain and to activate that orbital gyrus is great. Other ways to stimulate the vagus nerve, we talked about this before. Humming, singing, gargling, water, those will all activate the vagus nerve. And then a cool one for kids, I did a talk, I think it was almost a year ago, with Dr. Stephen Porges, who wrote the polyvagal theory. And he talked about how children should really learn how to play wind instruments. So like learning the recorder or the flute or the trumpet, if your house will allow that. because it's so good for their breathing and to activate the vagus nerve. But if you don't have any of those, trying to blow bubbles. So getting kids to blow bubbles is a great way to stimulate the vagus nerve as well, because they're practicing breathing. And it's super cute when you see a kid when they first, when my son was 2, he was trying to blow bubbles and he'd like try to eat the stick and then like kind of breathe in. He didn't really get the whole concept, but once they get it, it's really cool. The last area, I think, of the frontal lobe that I'm going to talk about is the dorsolateral prefrontal cortex. This is more of a network of communication. So it's a functional area of the brain that really just connects every other area of the brain. It undergoes a prolonged period of maturation, which lasts until adulthood. And like I said, it's not an anatomical structure, but a functional one, and it lies in the middle of the frontal gyrus. So it has connections with the orbital frontal cortex, as well as the thalamus, parts of the basal ganglia, the hippocampus, primary and secondary association areas. So like the temporal lobes, parietal lobes, and occipital lobes as well. So getting stimulation to this area, you could kind of decipher that you're really getting some good global brain stimulation as well. And one of the best ways to stimulate the frontal cortex and then some other areas is juggling. So if you've got some stuff at home, you can start juggling. And what this paper found was that specifically gray matter volume was found to increase with juggling training in the superior frontal gyrus as well as the posterior parietal lobe. And those are both representing components of the frontoparietal motor network. So you're activating these networks by juggling. And you could do a mental task like trying to solve a Rubik's Cube, which is very difficult and very frontal lobe, but why not solve it while you're juggling? Because that's easy, right? But so this kid is a genius. I don't know how he does it, but juggling in itself is a really good brain exercise, trying to learn how to juggle with 2 and then 3 objects. And then if you can go further, changing it by standing on an uneven surface makes it more difficult, but it's really a whole brain exercise. And then apparently there's contests where kids solve Rubik's Cubes and do it at the same time, which blows my brain. And then one of the best things is doing less, right? So meditation, it's so good for the front part of the brain. It can actually increase cortical thickness in your brain. So this study showed that meditation may offset age-related cortical thinning. As we age, our brain's got all these nice folds and gyri, but as we age, we start to lose our cortical thickness if we're not active, if we're not engaging in mental tasks, if we're not, socially engaging. So when the brain starts to lose those folds, things start to kind of slow down. And meditation has shown to actually almost offset that unwanted unfolding and unwinding of the brain. So it's pretty cool to think that just with meditation alone, so just with thought alone, you can structurally cause positive changes in your brain. And what they found was brain regions associated with attention and interoception, which is kind of an internal awareness of your body's state, and sensory processing were thicker meditation participants and matched controls, including the prefrontal cortex and the right anterior insula. So meditation for a better brain. And this is out of Harvard and Yale. Just like some small schools, no big deal. It's cool to see the big schools doing more research on alternative health and medicine. I did my nursing program at Duke, and they actually had a whole integrative medicine unit where they had chiropractic and acupuncture for PTSD and pain patients. So it's cool to see like the big hospitals getting into that stuff. And then eye movements. This is a little bit more clinical, but this is just a little short video to show you what an eye movement optokinetic stimulation looks like. So this patient's kind of following little objects across a screen, and you can see that there's a slow phase and a fast phase, and obviously she has to have some sort of ability to stay on top of that objects, and that's all really how well the frontal lobe is working, but also other areas of the brain. And the parietal lobe is an area of the brain that's going to perform the slow pull of the eye, and then the frontal lobe are going to be those fast movements called saccades. The cerebellum is responsible for the efficiency, just like it is for the efficiency of reaching out and trying to grab an object. It helps with the coordination of the movement as well, so that you can do a fast movement, but then stop on the next target appropriately, as opposed to overshooting or missing it and undershooting. And this can be really important in children who have difficulty with reading. They can't stay on task, they can't make sense of what they're reading because their eye movements are not efficient. So this is a cool little paper for all the nerds out there, but this paper just talked about gaze disorders. And what this shows you is the neuroanatomical pathway of what's called a slow pursuit. And what it shows you is that a pursuit is where the parietal part of the brain, that back part, it's going to slowly pull the eyes over to the same side. So if your eyes are moving slowly to the right, you're going to see that's right parietal lobe activity. If your eyes are slowly pulling to the left, that's left parietal lobe activity. It's a little bit more clinical than all the other stuff, but something good to know for any of the practitioners that follow our page. And this is just to show that saccades are generated from the opposite side frontal lobe. So if my fast eye movements are going to my right, it's the left frontal lobe that's responsible for doing that. And these are just those neuroanatomical pathways showing that. Kind of a nerd moment. I made these slides. I think I've shared them here before, but for the practitioners, you know, if you want, you can always message me and I can send you a free image of this. It's a good education tool for patients just to kind of get hey, why are you making me follow these weird stripes? It's really though, it's that those weird stripe following exercises are so good for your brain. And so what you can see here is this gentleman or lady or whoever is pulling the tape this way. So this is the direction of the tape. So they're right. So you're looking at the patient, so you can't forget. So this is their right brain up here, and this is their left brain up here. This is their left eye, this is their right eye. So you're pulling it to the patient's right. So the right parietal lobe is pulling their eyes this way, and then their right frontal lobe is going to shoot their eyes back to the left, and their left cerebellum is going to stop it. So this is you're basically assessing right brain health by pulling the parietal or the optokinetic tape to the patient's right. Again, this is all a little bit more clinical than for this talk, but for any of the practitioners out there that want to know this, and this is the opposite. So this is the patient's left eye, this is the patient's right eye. So up here would be their left brain, and up here would be their right brain. So a left pull of the optokinetic tape is going to be performed by the left parietal lobe, and then a fast right eye movement is going to be performed by the left frontal lobe, and the right cerebellum is going to coordinate the movement and stop that fast eye movement from going too far. This is just a little image I made. All right, so here's a quiz for you. The blank frontal gyrus is activating during go, no-go exercises. So this is the red light, green light game. This is the card game exercise. You're getting good frontal lobe activity, but which gyrus did we talk about? The answer is the medial frontal gyrus. Good job. I don't know if you got it right or not. Don't cheat. All right, so just to wrap it up, put it all together, some exercises you could do to help stimulate the frontal lobe. Physical exercise. It's a global brain thing, but it's really good for the front part of your brain. Motion is lotion for the brain. The more we move, more blood flow we get, more oxygen we move. Rest is obviously important, but we got to move, right? Our brain builds off of movement. So physical exercise. Games such as red light, green light, reaction sticker game, deck of cards. That's all good for the medial frontal gyrus. So it's kind of inside the frontal lobe there. Vagal nerve exercises for the orbital gyrus. So doing aromatherapy and deep breathing exercises to activate the vagus nerve can activate the orbital gyrus as well in the frontal lobe. Juggling and meditation, more of the dorsolateral prefrontal cortex area. And then saccades. Those are the frontal lobe generated eye movements from the frontal eye fields, which is an area kind of like right in here of the frontal lobe. So those are all frontal lobe exercises that you can do. There's actually some research that shows some video games where you have to kind of look around and survey the land. So sometimes it's like a shooter game, but there's other good games out there. Our good friend Kyle Daigle, his company SNA Biotech, they're making some great video games, and they just came out with some virtual reality stuff for neuro rehab, which is awesome. But the research shows that you're really stimulating front parts of the brain when you're having to kind of survey the land and do these fast eye movements to see the world in that video game. So virtual reality is something that could be really great for rehab of the frontal lobe as well, if not now, in the future. That's all I have for the frontal lobe. So I hope everyone enjoyed that little tidbit. And Hope everyone's staying safe and doing well, and we will see you soon. Have a good day. Bye.